Hello, I'm Chamuditha Jayanga. We would like to present our work titled Generalizing to Unseen Domains in Diabetic Retinopathy Classification. This work was conducted at the Mohammed bin Zayed University of Artificial Intelligence in United Arab Emirates along with Gayal Kuruppu and Dr. Muhammad Haris Khan. Diabetic retinopathy is caused by long-standing diabetes and is among the fifth leading cause for visual impairment. The prospect of early diagnosis and treatment could be helpful in curing the disease. However, the detection procedure is rather challenging and mostly tedious. Therefore, automated diabetic retinopathy classification using deep learning techniques has gained interest in medical imaging community. Akin to several other real-world applications of deep learning, the typical assumption of i.i.d data is also violated in diabetic retinopathy classification. Therefore, developing diabetic retinopathy classification method robust to unseen distribution is of great value. We noticed that when using a fixed temperature scaling coefficient to rescale the logic from both full classifier and the randomly sampled intermediate classifier can likely act as a bottleneck towards fully harnessing the potential of self-distillation. For instance, it ignores the fact that during self-distillation, the full classifier is not static and it is learning. Also, during early training, the prediction from the both full classifier and the intermediate classifier are unreliable. It can lead to model overfitting to source domain, causing more reliance on brittle, non-generalizable domain-specific features as shown in the attention heat maps. In this paper, we study the problem of generalizing a model to unseen distributions as known as domain generalization in diabetic retinopathy classification. To this end, we propose a simple and effective domain generalization approach that achieves self-distillation in vision transformers via a novel prediction softening mechanism. This prediction softening is an adaptive convex combination of one-hot labels with the model's own knowledge. We perform extensive experiments on challenging open-source diabetic retinopathy classification datasets under both multi-source and more challenging single-source settings with three different VIT backbones to establish the efficacy and applicability of our approach. Moreover, our method is also capable of delivering improved calibration performance than other methods, showing its suitability for safety-critical application including healthcare. In addition to that, we report the performance of several state-of-the-art domain generalization methods on open-source diabetic retinopathy classification datasets after conducting thorough experiments. We take ERM-VIT and SD-VIT with three different VIT backbones as our VIT baselines. Empirical risk minimization has shown competitive performance when compared with state-of-the-art domain generalization methods. SDVIT use scale divergent loss to self-distill the knowledge between the full network and randomly choose intermediate blocks. The SDVIT use a fixed scaling hyperparameter to soften the predictions. We believe this fixed scaling likely acts as a bottleneck for the self-distillation process. To this end, we propose to replace this fixed tree scaling with an adaptive convex combination of logits vectors with one-hot ground truth vectors. As training evolves, this combination gradually increases the influence of the model's own knowledge in the self-distillation process. We use this soft logic for self-distillation of knowledge between final classifier and the randomly sampled intermediate classifier using Gayal divergence. The classification loss at the final classifier and the Gayal divergence loss is added together as the final loss formulation. We believe that this would better allow enhancing the intermediate feature roles via the process of self-distillation, thereby facilitating the learning of cross-domain generalizable features. As shown in the blockwise accuracy comparison between our method and the baseline SDVIT, we achieve a higher accuracy in general at each intermediate classifier. We evaluated the effectiveness of our proposed method on four existing datasets, namely Aptos, IPAX, Mesido, and Mesido 2. It should be noted that each dataset has a high-class imbalance. Each dataset has a set of retina images taken under a variety of imaging conditions belonging to five classes, namely no DR, mild DR, moderate DR, severe DR, and proliferative DR. These images contain many artifacts such as being out of focus, underexposed to light, overexposed to light. Note that the images in these datasets are collected under multiple clinical settings using various cameras over an extended period of time, which introduce more noise and variations. Our method achieved notable and significant gains under multi-source domain generalization settings as shown with three different backbone architectures. In addition to that, we report the performance of several state-of-the-art domain generalization methods on open-source diabetic retinopathy classification datasets. We believe this will offer insights about how domain generalization methods perform on real-world applications such as diabetic retinopathy classification. In the single-source domain generalization setting, we train our model only on one dataset and evaluate on the other three datasets. The result in the following tables show that our method achieves superior performances in all the datasets even under heavy class imbalance. Single-source domain generalization is even more challenging in Mesidor dataset as the model does not have any data for proliferative DR class. We also evaluate the calibration performance of our proposed method under multi-source settings, utilizing two widely accepted evaluation metrics to measure the miscalibration of a model, namely expected calibration error and static calibration error. Results shown in the table illustrates the superior performance of our method compared to established baselines. Notably, our method not only exceeds the baseline in domain generalization performances, but also shows superior calibration performances. In conclusion, we study the problem of diabetic retinopathy classification under various real-world distribution shifts. Our approach is effective and simple. We use a prediction softening mechanism to effectively do knowledge distillation in vision transformers. We achieve state-of-the-art result on diabetic retinopathy classification under both multi-source and single-source settings while delivering improved calibration performances. We would like to thank you for your interest in our work.